virus there. Better that it's there than on your fingers, so that's kind of the idea of that. And even better if it's a tissue and then you throw it away. Um, there's a huge gap to this point between the scientific community and the general population. And so we do work with communications experts. We actually have communications experts on our staff in the form of Stacy DiLorenzo, Kathleen Fackelman, who are great at helping us to translate the science to the public and to put our faculty in front of the media. I've been very proud of some of our faculty who have been real warriors in this, who are in front of the media all of the time. Lena Wen, who we hired now about several months ago, who has been just a real trooper in terms of, I feel like every time I turn on the television, I see her explaining the science to the public. Dr. Christopher Mores, who's one of our virologists and who has been able to also, I think, do a really great job with communicating to the public. And they've been busy training more of our faculty. I just saw this morning Carlos Rodriguez Diaz was quoted in the Washington Post. And I think we all need to do that, not just those of us who are here in Washington and can talk to the Post, but many of you in your own communities, if you have an opportunity to talk on a local radio station or to local reporters for the local press, or even as I've done, if you have a neighborhood listserv where people are talking about it and you see something there that you don't think is accurate, I will go in on those and say, well, wait a minute, I'm a public health expert and here's the truth about this, to just help with, and by the way, when you live on the same block, I think you're a little more credible than, that it's somebody from the outside. The point about cell phones, yeah, people don't clean them very much. It's true. And so you're right. I mean, I wash my hands, but my hands, when they were dirty, might have touched this device. And do I wash that? I think that's a point well taken, because there is some probability if I transferred a virus onto this before I wash my hands, that the virus might transfer back onto my hands. It's not inevitable, but it might happen, and it's a good idea to think about that kind of thing. I do believe that the WebEx is being recorded for that question. And I did want to mention that there is a podcast that we are launching on Monday called Healthy You, Surviving a Pandemic. We're going to be also launching a blog. I think that Lena Wen is going to be our first speaker on our podcast, and I think our first blog is actually authored by me. I think just, scrolling back here, that, yeah, I think epidemiologists do as much as policemen and nurses for sure. I mean, we are not in the front lines in the same way that they are. So I'm going to have to say that I have complete respect, and if not awe, for people who are, running to the people who need help in this thing, putting their own lives at risk by treating them, getting them into care. I can't thank them enough. And I know some of you are in EMS and do that kind of work. And if you're on the line, thanks to you, as well as any of you who are nurses and doctors and are doing this work right now. I just can't thank you enough. Question here about food services. I've had my friends ask me that question all the time. I'm not aware of that as a means of transmitting the virus. I am aware that some people who have the virus have some GI symptoms, and so it's quite possible that that is a factor. Are we at a point yet where we have, Will asked the question, are we at a point yet where we have the data that if you are recovered, that you can get in and help? I think that on a theoretical level, it's true. I think that probably the government isn't going to say that that's okay without more data, and that that's something that we want to study, that we want to understand how that immunity is developing, how strong that immunity is. But I don't think that there is any good evidence, by the way, of people getting the virus twice, even though we heard that in the media. Uh, from what I can see, the cases that were reported out of China like that could well have been people who just harbored the virus for an unusual period of time. And it's possible to do a nasal test that's negative when the virus is there. We have learned that. It's not easy actually to take the sample. Um, um, the idea of DNR orders. So I mean, there are a lot of debates about this, the ethics around this, what we do when we don't have adequate supplies to be able to provide the health care that everybody needs. For example, again, what I told you about that we learned about this morning, the doctors in New York who are putting two people on one ventilator. Well, I don't think that that is a practice that has been subjected to randomized, double-blinded clinical trials. I don't know how you would double-blind such a thing anyway. And this is really kind of a almost like battlefield heroic medicine to get in there and just try to save lives. And so the ethics around that kind of thing are quite complex. And that's true. And under normal circumstance, you would not apply a therapy like that hadn't been, completely tested, and that you have a huge amount of evidence to support it. But that is the case. I really appreciate the comment from Jonathan Bautres that that he works in the military health system. We're not truly, in a mass casualty scenario. Although I think what's in New York is close to that, Jonathan, when you look at um, the the measures that people are taking in order to try to meet the need. And I'm not trying to scare you, but I do think that it is important for people across the country to understand not only what happened in China, what has happened in Italy and Spain, but actually what is happening in New York today. Because I think that when I look across the map of the country, I see many cities that are larger cities that have more than 100 cases, some of which have several hundred, some of which, like Chicago and LA, um, have over 1,000 cases. And that it's very important, and I think that it's that the governors and the mayors and the local leaders are taking this very seriously, because it's not only that we need to take these measures to do social isolation, but we need to be ramping up our capacity to treat and also to protect the health workers. um, Ed Salzberg is asking about, do we expect a significant increase in the capacity to test and test quickly? I wish for that. We've been told several times in the last few weeks that they're about to turn the corner on that. I know that our experience at GW has been that we've had to work very, very hard to increase our capacity to test, and that we have had frustrating situations, such as being told even somebody hospitalized with pneumonia to have an entire week to get a result back, and that we um, are not necessarily the first priority for ramping up in terms of receiving the supplies for testing, given what's going on in New York. And so we do seek. I don't know if it's going to work out, Ed. We're working with the hospital on whether on a research basis we could test all of the essential health workers there. their primary concern, and God bless them for this, their primary concern is testing their patients. But I'm concerned about the health workers, because if the health workers become ill and can't work, that is going to further restrict our capacity to take care of patients. And but it does make sense to me that you'd have more testing. Other countries have had more testing, and I think that kind of the bureaucratic and administrative issues that have occurred in the U.S. around this have been very frustrating for many of us. It is what it is. It is where we are. We have to work within the country that we have, not the country we wish we had. But it's not too late to work on expanding this. The epidemic is moving across the country, and it's at different stages in different areas. And that gets back to the question from Laura about how they did it in Korea, other countries. Well, I think part of it is that we just have a different regime for the approval of medical tests that's turned out to be too sticky and slow for the pace that we need when we're dealing with an actual pandemic, even though I think Congress believes that it had passed some laws that would have sped up processes like this. In reality, the actual execution has not been fast, and I think that we all have to admit that. A sense from modeling as to how many cases truly there are. So I'm going to give you a guesstimate. This is not a real number, but from the modeling of the epidemic in other countries, my best guess is for every case that we are aware of, there are probably 11 other cases at least that are in the population. And it might even be more, because our rate of testing in the US has been so much lower than everywhere else. So in the US, it could be even, for every case we know about, there are even more, 20 or 30, but there's at least 10 or 11 of them for every one that we know about. I'm pretty sure of that. Medical triage could be a whole other area to try to have a little seminar on. I realize that we got into that discussion because of the ethics around it, but I also think that there's a lot of innovation that's happening in that space, and that it feels really good to see that. One of the things, a question about new strains, there is, to my knowledge, there are no new strains. That even though the virus mutates, mutations are insignificant in terms of the pathogenicity and the behavior of the virus in the population. They're the kind of mutations that allow us, though, to track it over time, and also to understand about transmission chains. And by the way, we're very interested in doing that kind of work, in our laboratories, just as we do with HIV/AIDS, where we can see minute mutations in the HIV virus, and it helps us to understand how HIV is spreading in the DC region. And that tool could also be used for COVID-19. So I think that I'm going to want to wrap up soon. I think that we are learning a lot from New York that's helping other states prepare. I hope that they're taking the lessons from New York to heart, and that other communities are much more rapidly moving toward taking measures like social distancing, as painful as it is economically. That even more pain, I think, is created when we have so many people who are ill, the disruption that's caused in our healthcare system, and obviously the loss of life, which is tragic, and which is so difficult to watch even from this distance. I will say that I have been impressed by the American people. I think that they're a lot smarter, certainly, than I've given them credit for in terms of their ability to recognize what is good information and what is not, and to take action, whether that's in their communities, in their school, in their state. The American people are amazing. They're innovative. They just a little example of what I've seen in the library. Can we use the 3D printer to, make a protective mask? I would have never thought of that the library, the School of Engineering would be in there helping our hospital with getting PPE together. This is happening everywhere in the country. I've heard of clothing factories shifting to sewing N95 masks, making protective gowns for the healthcare workers. And even though I think, many people think of us as a people who are, maybe, overly privileged, rich and spoiled country, maybe a lot of countries maybe look at us that way. Um, we're not. I think that we're people who pitches in to help each other we care about our communities, we care about our neighbors, and I think that we are the most innovative people on the planet. And I am so impressed with all of the work that's going on to find better ways to try to fight this pandemic. So I just wanted to close with that, because even though there are days when I feel hopeless because of, frankly, the rather halting and uncertain nature of the national messages that come across. But then I see how communities and states are just barreling forward to do the right thing. And I realize that that is the strength of our nation, that we are a democratic society. We aren't doing things just because people order us to do them. And if they didn't order us to do them, we do nothing. We take the action that needs to be taken in our communities, and I'm very proud of our country for that. And it's exciting for me that all of you, that many of you are out there in communities across the country, and I'm sure participating in that. And I did want to mention that we are interested, the school, in hearing your stories. And if anything that if you certainly, if you're involved in this, keep a journal, keep notes of what's happening, record your observations. It's very important. This is probably the public health event of our lifetime. And I know that I'm many days exhausted myself. Sometimes it's exhilarating, it's often exhausting, but your story is an important part of this, and we want to hear it. So thank you so much to all of you for joining us.